Hello. Assalamu alaikum, everyone. My name is Mohammad Aljumaa. I'm a second year medical student, and today we're going to talk, inshallah, about anatomy of peritoneum. So before of all, this is my contact info. If you have any question after the lecture, I'll be happy to help. And if I'm going too fast or too slow, please let me know. And if you have any question, directly stop me. Yalla, bismillah, let's start. So first of all, of contents, what we're going to talk about today. We're going to start, first of all, with a revision of the GIT, and then anatomy of peritoneum, then clinical aspects, and then we're going to test your knowledge of the lecture through some questions. Let's start. First of all, the anatomy of peritoneum. GIT, it mainly consists of the mouth. Okay, can you see my mouse?
Yes.
Okay, so it starts from the mouth where the food enters, and then to the pharynx, esophagus, stomach, small intestine, which is made up of ileum and jejunum, and then large intestine. And in the GIT, we have three main digestive glands, which are the salivary gland, liver, and pancreas. Just 1 second. Okay, liver and pancreas. So you may say that liver and pancreas are organs. Yeah, they are organs, but at the same time, they are exocrine glands that secrete their enzymes into the duodenum, and especially the first part of the duodenum. The salivary gland secretes to the mouth. Now, let's talk about the first part of the peritoneum, which is the abdominal cavity. Abdominal cavity, it's all the parts here in the midline of the body, okay? And it consists of two things. The first is the peritoneal cavity, and the second is the retroperitoneal space. So as you can see here, the pink arrow shows us the peritoneal cavity, which is mainly anteriorly, and the retroperitoneal space, which is mainly posteriorly. Now we're going to talk retroperitoneal space and peritoneal cavity, which forms the abdominal cavity. Now we're going to talk about the peritoneum. So what's peritoneum? Peritoneum, it's a fluid-filled sac which consists of two layers, the visceral and the parietal. So the visceral, it mainly surrounds the internal organs, while the parietal, it's mainly on the abdominal wall, exteriorly. So between these layers, we have the fluid. As we mentioned, that peritoneum it's a fluid-filled sac. So the fluid it's found between the parietal and the visceral layers. طيب, what's the function of this fluid that's found between these layers? Its function mainly to prevent friction or to mainly provide lubrication for the viscera of the organs so they can move easily on one another. So as you can see here, the red line on the right picture shows us the parietal peritoneum. As we mentioned, it's on the abdominal wall, and the visceral peritoneum, it's surrounding the internal organs or the viscera. Tamam? And here also in this picture on the left, we have the parietal peritoneum at the abdomen and at the abdominal walls, and the visceral peritoneum around the organs. Now, let's talk about mesentery. Mesentery, it's mainly a double layer of peritoneum that encloses organs, and it connects them to the abdominal wall, either anteriorly or posteriorly. And also, amentum, it is a mesentery, but it's extended from the stomach to the organs. Now, mesocolon, it's also mesentery, but mesocolon, it's specifically for the large intestine. It encloses the large intestine. So as you can see here, this yellow structure, this is, it's called mesentery proper. It's mainly for the small intestine. We'll talk about it in a while. What's the function of mesentery? Mesentery, it mainly provide a passage or a pathway for the neurovascular bundle to the GI organs. And for example, as you can see here, this is the jejunum, okay, and this is the ileum. Between them, we have the mesentery proper, okay, which is for the small intestine. And through it, as you can see, we have blue and red points, which are like veins and arteries. So, and I mentioned that with the mesentery, it attaches the organs to the posterior and anterior abdominal wall. So we have two main mesenteries, the dorsal and the ventral. So the dorsal can give us a greater omentum, mesentery proper, transverse colon, and sigmoid transverse. While the ventral will give us lesser omentum and falciform. Now, just once we label them, inshallah, you'll understand more. So as I mentioned, we have the ventral mesentery. It connects the organs to the anterior abdominal wall, while the dorsal, it connects to the posterior abdominal wall. The organs to the posterior abdominal wall. We also have mesenteries for the liver. And for example, we have three main. Okay, the first one, which is number one, it is coronary ligament. The coronary ligament, it mainly attaches the diaphragm to the liver. Okay. Number two, we have the falciform ligament, which it mainly divides the liver into left and right lobe. The third one, which is continuous with the falciform ligament, which is the round ligament, or you may find it in some texts as ligamentum teres. So, as you mentioned, the coronary for the diaphragm and liver attachment, falciform divide the liver to right and left, and the round ligament, it's continuous with the falciform, and you should know that the round ligament attaches the liver to the umbilicus, and it's a remnant of the left umbilical vein. Right. Now, let's have also some extra mesenteries. So, number one, as you mentioned in the previous picture, that they are a bit yellow colored. تمام. Here's the first one. As you can see, this is the small intestine. So, and I've mentioned before that the small intestine, it's called mesentery proper. Now we have the mesentery for the transverse colon, that will be transverse mesocolon. As you mentioned before, and you should know this, the mesocolon, it is for the large intestine mainly. طيب. Now we go down, as you mentioned, we were in the transverse. Now we are in the sigmoid mesocolon, because it's still part of the large intestine. And here we have the appendix, the mesoappendix, which connects the appendix to the mesentery of the small intestine. Do you have any questions till now? All good? Okay, let's continue. Now, inshallah, this part will be a nice and simple one, يعني. I know the part 4 was a bit boring. طيب, the intraperitoneal organs, it's easy, just the organs that are covered by the visceral peritoneum, which are the stomach, jejunum, cecum, transverse colon, sigmoid colon, spleen, liver, and gallbladder, and uterus. Now here, as you can see, the spleen is found to the left of the stomach, okay, to the left of the body. Here is it. It's the red structure here. And the uterus, it's found in the upper part of the reproductive organ of the females. Right. Now, let's label this one by one. So the first structure is the liver. Okay. After it, we have the gallbladder. Then we have transverse colon. Then we have the cecum, appendix. And then on the right, on the left side of the body, on the right side on the PowerPoint, we have the stomach, we have the jejunum, ileum, both form the small intestine, and then we have the sigmoid colon. Now we've talked about the intraperitoneal. Let's go to the retroperitoneal organs. Retroperitoneal organs are organs that are not fully or not, they are not as part covered with the peritoneum, which are the pancreas, duodenum, descending colon, rectum, kidney, ureters, and bladder, urinary bladder, sorry. But guys, you should also differentiate between your urinary bladder and the gallbladder. The gallbladder, which is close to the liver, and the urinary bladder, which is found low. Fine. Also, you should know that the duodenum, the first part of duodenum, it's found, it's intraperitoneal and covered by the visceral peritoneum, while the second and the third part, it's not covered by retroperitoneal organs. And as you can see here, I highlighted with yellow the organs that are mentioned here, which are the kidneys, pancreas, ascending colon, the ureters, bladder, and the lower rectum. Fine. Now let's have a small type. So here we have an organ, okay, and it's covered by it's like covered it's covered by the viscera. So what should we call this organ? Like, is it intraperitoneal or retroperitoneal?
They're saying intra.
Okay, تمام. Intraperitoneal. طب it's covered by what viscera? Is it visceral? Sorry, it's visceral peritoneum or parietal peritoneum?
Visceral.
Yeah. Okay. And we have the parietal peritoneum. Now we have, and we mentioned the mesentery, which provides the pathway for the neurovascular bundle. As you can see here, the arteries and veins can pass one second. Yeah, they can pass here to the intraperitoneal organ. And here we have the retroperitoneal organ. Now let's go to the omentum. What is omentum? As you mentioned before, we talked about omentum. I'm now going to go deeply in it. The omentum is the fold of peritoneum that connect the abdominal organs to the abdominal wall. We have two omentas, the lesser omentum and the greater omentum. The lesser omentum, it's as you can see here in the picture, I've like faded or hided the liver. This white structure, this is the lesser omentum, tamam? And it's mainly consists of hepatogastric ligament and hepatoduodenum. Hepatogastric from the name, and it connects the liver to the stomach, and hepatoduodenal the liver to the duodenum. Fine. Hepatoduodenal ligament, it's important. Why? Because it contains the DVA, or what we call it the portal triad type, which are the bile duct, portal vein, and proper hepatic artery. Then we have the greater omentum, and as you can see here, it's large a bit. It's mainly anteriorly, and it provides protection for the internal organs. And as you can see here, through the hepatoduodenal ligament, we have the portal triad, which are the bile duct, portal vein, and proper hepatic artery. Peritoneal cavity. Peritoneal cavity, as you mentioned, it's part of the abdominal cavity. Peritoneal cavity, it's mainly made of two sacs, the greater and the lesser sac. The greater sac, it's the main compartment, and it extends from the diaphragm to the pelvis down. And the lesser sac, it's small, and it's found behind the stomach. These sacs, they should communicate. How they can communicate? They communicate by a foramen or opening of lesser sac, which is called epiploic foramen or Winslow's. So guys, you should know the both names, epiploic and Winslow's foramen. And as you can see here, anteriorly we have the greater sac, and it's a bit in the middle, and it's the main compartment of the peritoneal cavity, while the lesser sac, it's found posterior to the stomach. And as you can see here, this green arrow, it shows you the epiploic foramen, where the lesser sac and the greater sac communicates. Now, the epiploic foramen, what borders the epiploic foramen? Let's put the picture. Okay. So here's the epiploic foramen. Okay. So as you mentioned, it's between the lesser sac and the greater sac. Anteriorly, we have the hepatoduodenal ligament, which, as we mentioned, contains the portal triad, bile duct, vein, and artery. Posteriorly, we have the inferior vena cava. Superiorly, we have the caudate lobe of the liver. And inferiorly, we have the first part of the duodenum, which is an intraperitoneal organ. Now let's talk about the clinical aspects. Inshallah, it will be simple. The clinical aspects are not hard. First of all, we have two deepest points of the peritoneal cavity. The first is it's called the hepatorenal recess, which we can also call it Morrison pouch. The second, it's rectouterine pouch. Rectouterine, it's named only in the females. In the males, it's called rectovesical pouch. The hepatorenal recess, while you are in a supinated position, you will the extra fluid will accumulate there. Okay, while you are in erect position, the fluid will accumulate downward in the rectouterine pouch. Okay, and they are so important. You should know both names, hepatorenal and Morrison, and rectouterine, rectovesical, and the Douglas pouch. And yeah, let's talk about the acute peritonitis. So from its name, peritonitis, inflammation of the peritoneum. So we have inflammation of the peritoneum, and what are the symptoms of the peritonitis? First of all, we have a spasm of the anterolateral abdominal muscles. We're having little guarding. The abdominal wall, it's hard that you can't palpate the organs there. And we can't palpate the small intestine, large intestine, or whatever. The second is that we have high temperature. And the third is leukocytosis. So as you mentioned, it's inflammation of the peritoneum, and we need to have a high amount of white blood cells. So we have leukocytosis. Now we have the last part of the lecture, which is ascites and paracentesis. For the ascites, it mainly means the abnormal fluid accumulation in the peritoneal cavity. What happens so that we can have ascites? We have inflammation of the peritoneum, we just mentioned it, and spread of cancer cells to the abdominal vessel, or metastasis, you'll take it later. Okay, I have abnormal fluid in the abdominal cavity. How can I solve this? It's easy. You just inject a needle or catheter, and you can drain out the fluid. So what is this called? It's called paracentesis. Okay, So paracentesis of the abdomen, it may be performed either to analyze the fluid, يعني it's not necessary والله no I need to take out the fluid. You can just take a sample and analyze it, and if it's a tumor or anything else, and or you can drain the whole fluid. طيب, how does this work? First of all, you put local anesthesia. تمام, you inject a needle or catheter to the linea alba. So look here, if you can see the umbilicus. تمام, هيك في a bit of protrusion. Below it, we have a structure called linea alba, where you inject the catheter or the needle after you put local anesthesia, and then you drain the fluid. Okay. Good point. Do you have any questions? And we're done mainly, but في some the third objective, which is the questions. Okay, no questions. Let's start. Bismillah. The questions. First of all, we have our first question. So I'll give you, let's read it and it's easy, inshallah. A 35-year-old woman comes to the local hospital with abdominal tenderness and acute pain. On examination, her physician observed that an abdominal infection has spread retroperitoneum. Which of the following structure is most likely affected? طيب, he told us إنه في عندنا abdominal infection و retroperitoneal. So retroperitoneal. So what do you think is the organ?
Someone said B.
B. E. I don't think so. Just let me check if it's B. No, it's not B. Retroperitoneal. B is intraperitoneal.
Someone said E, spleen.
No.
D.
Okay. حذره. Yeah, it's D. Because نحن we mentioned إنه the descending colon it is 1 second. Yeah, the descending colon is retroperitoneal, and all others are intraperitoneal. طيب. Let's go to the second question. Which of the following structures is a remnant of the embryonic ventral mesentery? طيب guys, we mentioned إنه the ventral mesentery give us two things. Which one of the following is one of them?
They're saying D.
Okay, تمام, excellent. It is falciform ligament. يلا, next question. 48-year-old female is admitted to the hospital. To the hospital with a distended abdomen. A CT scan examination provides evidence of the presence of ascites. In which of the following locations, with an ultrasound machine, most likely confirm the presence of the ascitic fluid with the patient in the supine position? طيب, as we can see here, guys, we have this ultrasound, CT scan, and we have here like a black bag or something like this. Like, what do you think? Where do you think there is the accumulation of fluid?
Some people
And
are
look at,
saying B, some people saying C.
sorry.
Some people are saying C, others are saying B.
Okay, طيب. Let's see the picture. The picture is showing us, يعني, to the right of the picture, as you know that whenever you sit for a CT scan, your right is your left and your left is your right. And number one, it's on the right. Number two, you can see the liver. So as you mentioned, we have a pouch أصلا, it's called hepatorenal rhesus. It is يعني B, not D. Okay, sorry, not C. Right. Let's go to the next question. A surgeon was trying to identify Winslow's foramen. Which major structure lies posterior to the epiploic foramen?
C.
C, exactly. Okay. Patient presented with a posterior gastric ulcer. Okay, posterior gastric. Where would the fluid most likely accumulate?
A, B, C.
Okay, تمام. It is B, omental bursa. And guys, you should know that omental bursa is the same as lesser sac. تمام, يعني both are the same structure. So ليش يعني why it is omental bursa? لأنه he told you posterior gastric ulcer. Posterior to the gastric. فنحن what do we have posterior to it? We have the lesser sac. So it's omental portion. طيب. Now let's have this final drawing. Okay, let's bring it all together. طيب, before يعني we start with it, we have here the liver, small intestine, pancreas, transverse colon, uterus, bladder, and rectum. And this is a female because of the uterus. طيب. Number one, what do you think is it? يعني it's above the liver, okay? Diaphragm and liver. What do we have? Okay, طيب. This is a drawing, تمام, from Dr. Olena. We have liver, تمام, small intestine, pancreas, transverse colon, uterus, bladder, and rectum. طيب, نحن هون above the liver, between the diaphragm and the liver, we have a ligament. What is it called? And it suspends the liver mainly. Okay, C, يعني what do you mean by C? No, not falciform. Falciform, it is okay, تمام. It is C ligament, yeah, يعني بس you should know the whole name طبعا. It is called coronary ligament. تمام. Number one is coronary ligament. Now, number two, it's the ligament that divides the liver into right and left lobe, which is exactly, falciform. طيب. Number three, we mentioned that there one of the omentums, it's either greater or lesser, connects the liver to the stomach mainly. So what is it called? And it has two parts we'll talk about. It's not a ligament. It's okay, exactly, lesser, yes. Lesser omentum. Lesser omentum, as you mentioned, so yes, the lesser omentum consists of hepatoduodenal ligament and hepatogastric ligament. طيب, number four, what do you think is it? يعني it's between يعني the stomach and the transverse colon. No, not transverse mesocolon, no. يعني think of the name between stomach and the transverse colon. No, not a great momentum. Yes, Qusay, you're close. It's called gastrocolic. تمام, it's not duodo because duodo is above يعني. Gastrocolic between the stomach and the large intestine. طيب, number five. Number five, one of you mentioned above. So, يعني repeat it. What is it? No, not mesocolon. Exactly. It's a great momentum. Number five is a great momentum. Number six. Okay, yeah, it is mesocolon, but mesocolon transverse. Mesocolon transverse. تمام. طيب. Number seven. Number seven, it is for the small intestine, and we mentioned in small intestine. So what is it? Exactly. Mesentery proper. طيب. Number seven, mesentery proper. طيب. Number eight and nine. Number eight, it's يعني both are like deep points in the peritoneal cavity. Okay, rectouterine pouch. Exactly. Rectouterine and ventricouterine. Uh, yeah, we have now 10, 11. So what's 10? What do you think is 10? هيك it was anteriorly. Excellent. Greater sac. Yes, greater sac. طيب, number 11. Exactly, lesser sac because it's behind the stomach. تمام, lesser sac. And we're done. Alhamdulillah. It was short, simple, inshallah يعني. And inshallah, I hope you benefited, inshallah. طيب. Thank you so much for not sleeping. يعني it's anatomy صراحة. Thank you so much for attending. And if you can please fill the feedback. And thank you so much. And we're done. Do you have any questions?